Welcome to our series, Moving America Forward. Each week we'll be focusing on America's entrepreneurs as they take us to new roads, new opportunities, new ways to fill the gaps left by today's failing companies. Our series will be looking at that and a lot more. So come with me and watch as the entrepreneurs of our nation move into the future.
And I'm Doug Llewellyn here in our studios in Los Angeles with our guest, who I know you're going to find very fascinating indeed. He is the chairman and the CEO of WellHealth Quality Care, which is based in Las Vegas. Our guest is Dr. Warren Volker, who happens to be an MD as well as a PhD. He is a pelvic reconstruction surgeon, but he's also a professor on the faculty of UCLA and the University of Nevada. Dr. Volker, nice to have you with us.
Thank you, Doug, for having me. I'm so excited to be here on Moving America Forward.
You are indeed welcome. Before we begin, a little while ago you had a chance to have a conversation and answer some questions from William Shatner. Let's take a moment to look at a brief portion of that right now and to see just how it went. Okay? Mm-hmm. All right, good. Let's take a look.
Good to have you here. I'm very concerned about health care. The real issue is, how do we keep Americans healthy? And I understand that is one of your goals. So tell me, what are you doing to help us stay healthy? Any new procedures and developments that help people to live more productive lives and in so doing, move America forward?
Mr. Shatner, we developed a healthcare network whose goal is to improve healthcare outcomes while lowering costs, and in doing so, solve one of the biggest problems in healthcare today. And in that is how we are moving America forward.
That's very, very interesting what you told them, Mr. Shatner, is you said that you've developed this network that is designed really to improve health care in this country. What does WellHealth Quality Care, what does it do? What's different about it, and what makes it work? Describe it for me.
WellHealth Quality Care is an accountable care network, and what that means is that the patient care that's delivered from our physicians, our providers, the hospitals, and ambulatory centers are all based on quality measurements and accountability.
So the big difference then from other healthcare organizations is that this really is based on the results that doctors get in treating patients. Would that be accurate to say?
Correct. How healthcare is delivered right now, and is the patient is seen by a provider, seen at a hospital,
right.
And it's just assumed that the patient gets a high quality experience, gets a good experience. What accountable care does is actually measures that. It not only provides the care, but how was the outcome of that care?
So in other words, the less a patient has to go back to see the doctor for a problem, it indicates he's getting better care.
Correct.
Which would seem to make sense. I'm prompted to ask you, who benefits from this kind of a system?
Well, the main beneficiary, and as it should be, is the patient.
Right.
If the patient is getting timely care, the right access, seeing the right provider, getting the right treatment, and a measurable treatment and a measurable outcome, the patient benefits first and foremost.
Right. But also the doctors benefit, the healthcare providers benefit, the hospitals who are part of it, they all benefit. Mm-hmm. Really, it's a win-win for everybody.
Correct. And there are really truly three stakeholders in healthcare. Aside from the patient being number one,
right.
is the providers, are the physicians and the hospitals providing the care. And the better care that they give, the more timely care they give, it brings down costs. And if you can save costs, you can share more of the financial rewards to those providers who do better care. The third part of healthcare, of course, is the payers, whether it's an employer, a union, Medicaid, Medicare. All of those
they improve.
Improve, right.
The one thing I noticed in some of the written material is it gives this kind of system gives the doctors the opportunity to spend more of their time with the patient, to really learn more about the patient. They're sharing the patient's records from what they've seen from other doctors who've been dealing with this patient. That's one of the big things, isn't it?
Correct. And the emphasis, instead of just seeing patients by the number, is to reward the physician on seeing a certain number of patients,
right.
but also being rewarded on their outcomes. So they get compensated not only for seeing the patient, but they get rewarded also by the outcomes that they provide.
So that's different. It's really different than other systems, isn't it?
Yes.
I mean, that was the whole goal in setting this up. I know this is relatively new. It's been in the works now. You said for like 3 years you've been in the planning stages, putting this together?
Correct.
It's actually been in effect for how long, actually, at this point?
Well, if you look at the best example is Medicare. 7 years ago started implementing Medicare Advantage programs around the country. Okay. And there are numerous organizations where the primary care providers are actually managing the patient and getting compensated to see a certain number of patients, but also getting rewarded on an outcome score. So this has been in the works through Medicare. Now it's just being applied to the whole population.
All right, so when did it, I know this is in Nevada. It's only the state of Nevada we're talking about, right?
Correct.
You started it when? When did it go actually into effect?
We actually became into effect of just this past November.
And so far, you were indicating how many doctors? A lot of doctors.
Yeah, we currently have 1,500 physicians in Southern Nevada that are participating in the program.
And hospitals as well.
And hospitals, yeah. We have all of our hospitals except for 2 that are provided in the network as well.
So, you know, there's no question, we have a lot of health problems in this country. Some statistics I have that are really interesting. The fact that people are living longer these days, much longer than the original, you know, statistics that said how long a man or a woman was expected to live. We've really gone way beyond that now. And that's causing problems because as people get older, sometimes they have more problems, which is causing health care to get more expensive. Obesity has become a very serious problem, hasn't it?
Yes. And all the ramifications of obesity. And the big concern is childhood obesity. I mean, we have approaching 40% of children, which indicates up to age 16 who are obese. And what happens is the long-term effects, diabetes, heart disease, cardiovascular problems that come with that over a long time period of obesity.
The other statistics, 40% of women in this country are considered obese, 37% of men, and as you pointed out, almost 40% of kids. That leads to a lot of problems. Something else very interesting. I understand we spend here in the United States 2.5 times more than other countries do on health care, yet we rank number 27 in the list of countries who have the most healthy people. We're way down the list.
Yes. The World Health Organization produces these statistics on a yearly basis. And the United States is actually mediocrity around when you compare other countries, developed countries. That's comparing us to Italy, the UK, France. And we just don't measure up, even though our healthcare dollar, we spend so much.
Let me ask you about the future of this kind of an organization that you've started now. I guess the key for an individual who might be seeing this, wondering, saying, that's a good idea, how do I benefit from this? Their benefit is to go see a doctor who's a part of this program. Would that be right?
Correct. In our market, you have the option of seeing a WellHealth provider and looking for a WellHealth provider, whatever health plan you happen to be on. And by choosing a WellHealth provider, that provider in our network will see you and be compensated to see you, but also be rewarded for the better outcomes. Also, we engage our patients. Our patients have to be involved with some of the illnesses they have, especially chronic illnesses. So our providers are interested in getting them involved. So not just seeing them time and time again for example, diabetes and the complications that happen over time, but also get them engaged and be able to promote and to reward the patients by doing better with their own care when they go home.
You know, as a doctor who is a surgeon, and you're a practicing surgeon, it's interesting, you're a pelvic reconstruction surgeon. A lot of people might ask, what on earth does that mean? What do you do? Tell me briefly.
Yeah, sure. So it's a subspecialty actually of women's health and a combination of urology and gynecology care. And so my patients are patients who develop pelvic organ prolapse, develop urinary genital problems, as well as precancers and things like that. So I address all those. The biggest breakthrough in our world is doing surgeries that patients used to have to be cut wide open for. We're able to use minimally invasive laparoscopic surgery, robotics to do surgeries where patients would be in the hospital 3-4 days and recover for 8 weeks.
Yeah.
We can actually do those surgeries the same day. Patients go home the same day, back at work 7 to 10 days. Dramatic improvement in the recovery and pain that patients experience.
Yeah, you put a Band-Aid on them and they walk out.
Essentially, we use Dermaban. We actually use surgical glue over 3 small incisions about the size of an eraser.
Really?
Correct.
Boy, I tell you, it's remarkable, the advancements that are going on. I wanted to ask you about what you see for an organization like that. You're really injured. You're a businessman. You know, here you are as CEO, the chairman of WellHealth Quality Care. You're a practicing physician, a surgeon, and you're also teaching at UCLA and the University of Nevada. Which comes first in your list of? I guess being a surgeon would be number one.
Yeah, you know, I have to tell you, I always tell everybody the most enjoyment I get is still taking care of patients and teaching. And all of us are that way. I mean, I think all physicians have that in them. They get enjoyment of taking care of their patients. We're rewarded by how our patients do, no matter if you're a surgeon or you're taking care of chronic illness. But physicians now have to be more responsible for healthcare dollars as well and think of economics. We never were taught that in medical school. We didn't think about that. But I'll tell you, the students that are coming out, residents that are coming out in training, they're actually getting classes and they're learning about this. We're learning the impact of how we care for patients and the importance of how that contributes to the overall cost of what we do.
That's very interesting. And with the advent of Obamacare, you know, on the horizon, it comes into effect in 2014, really. Do you think it's going to help your organization being a complement to Obamacare? I mean, is it going to be good for this country? What are your feelings about that?
You know, the debate on Obamacare, is it good, is it bad? How do we see? The bottom line is we needed to change. We needed to change how we deliver, how we take care of patients. WellHealth really falls in line with all the incentives to move that change.
So it's good.
It's good.
And
yeah.
it's going to be good.
Yeah.
Well, Doctor, listen, thank you. We really appreciate your coming. This has been most interesting. I wish we had more time to go into this in detail, but all I can tell you is you're very, very interesting, and I think your organization has a long way to go. Thank you so much.
Thank you so much, Doug, for having me on your program.
You are welcome.
This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present this prestigious award to Dr. Warren Volker, the chairman and CEO of WellHealth Quality Care of Las Vegas, for the outstanding work his organization is doing to help keep America moving forward. Doctor, pleasure to give this to you. Congratulations.
Doug, thank you so much. It's an honor to accept this award and being on Moving America Forward.
You're welcome.
That's it for another edition of Moving America Forward. I'm Bert Tenzer. Join us again as we continue to bring you the entrepreneurs who move America forward.
I'm William Shatner, and for all of us at Moving America Forward, thanks for watching.